Good afternoon, everyone. Thank you so much for joining us for this important panel discussion titled Women of Impact. I would like to invite you to take your seat so you can be a part of this conversation. And please remember that the hashtag is hashtag ICFP 2025 if you want to exchange and take this conversation on to social media as well. And welcome to all of the people who are also joining us virtually, and of course to you all in the room in Bogotá. Joining me on stage is a phenomenal group of women that I have personally known, have read about, and very excited to have met in person today, some of them. Some, of course, are leaders that I have learned a lot from as a young medical doctor in the SRHR space, maybe about 15 years ago now. I'm not so young anymore, but have always really looked up to them as part of the work that they do personally, but also the institutions that they represent in the space. And we know that being women and being leaders in global health has its own challenges. And this is why I say in most in spaces that I speak, that the work we do in SRHR, for many of us, we came into it because we were young women ourselves who either needed information or services, or we knew of other women who needed the same and could not get that. So there is a level of activism that we bring to the space as leaders in women's health, in SRHR, whether you are in grant making, in research, in academia, in civil society and feminism, and as well as research and communication. So what does impact look like? What does it look and feel like being a woman leader in the space? This panel is designed to bring you these diverse voices of leaders from the field. And I hope that this session will be as dynamic as I know the leaders and the women on the stage to be, that we can have an intersectional, intergenerational dialogue, understanding the ways in which power and resources shape our ability to be successful as leaders and as women in the space. And I would like, firstly, to introduce to you Dr. Keisha Pollock Porter, who is the Dean of Johns Hopkins Bloomberg School of Public Health, an institution that I, myself as a young woman, has shaped who I have become as a leader. So for many of us who are ICFP fellows and alumni, I know we have a lot to say about Dr. Keisha, but specifically Johns Hopkins. So welcome to you.
Thank you. Thank you.
And secondly, another comrade of mine, we meet each other in many global spaces, causing good trouble, I say. It's Dr. Sanjana Bhardwaj, who's the Deputy Director of the Program Advocacy and Communications at the Gates Foundation. Welcome, my dear friend. And Dr. Pascal Alotti, someone many of you will know, and her work as the Director of Human Reproduction Special Program titled HRP at the WHO, doing really important scientific work, giving us the foundation from all of our visions and creativity can really stem from. So welcome to you, Pascal. And again, Dr. Esther Corona. I think you are the epitome of what it is to be a woman leader in global health. Your openness always to young people, your openness and willingness to always share your personal story of becoming in this space is really important. Besides the many formidable things that you are, a clinical psychologist, the president of the Mexican Association for Sexual Education, the first one in Mexico, yeah? And currently serving as the vice president of the World Association for Sexual Health, which is WAS, and has been collaborating with UNFPA and UNESCO and WHO, amongst others. So welcome to you. And Julie Salamanca. Hello, my friend, and welcome. Julie is the executive director of the Trans Health League in Colombia. She's a human rights defender, an activist and researcher, and a communicator for social change and justice. And she's someone who dedicated her life's work to defending the rights of trans people. And she's passionate about defending the rights of people who engage in sex work. Happy to know you, and welcome, Julie. And so for this conversation, I was just saying earlier, it feels like a conversation between friends. We're exchanging notes about how to be, how to grow in the space, albeit among many challenges. But I think for this point in time, we are going to be intentional about focusing on joy and creating joy and vision for the future that really many of us and all of us can and see each other through in the ways that we lead as women on the stage. And so my first question will be, inviting you to introduce yourself to us, how you came into this space, how you saw your own story of becoming, perhaps, and what makes this work so important for you. And perhaps in starting to incorporate some of the big thematic focus we have for this session is about women's leadership, of course, and equity and inclusion above it all. And I just want to take a moment to welcome on stage Dr. Abla Al-Alif, who's the Deputy Minister of Health and Population in Egypt. She's joining us on stage as she takes on, no worries. It's okay. We are happy you could make it. Thank you very much. We were just starting our conversation and just introducing Dr. Keisha Pollock-Porter from the Dean, who's the Dean from the Johns Hopkins School of Public Health, just to give us her introduction of how she came into this role, her story of becoming as a woman leader in global health. So over to you.
Great, thank you so much. I am honored to be on this stage with all of you and looking forward to the conversation. When I think about my story, the origin of my story as a women leader, I have to think about my parents who emigrated to the United States from the Caribbean. They met in Brooklyn, New York on a date, got connected, and they came to the US from the Caribbean seeking prosperity, a better opportunity for themselves. And throughout my entire life as a child growing up in New York, they very much promoted the responsibility I have to lean into my purpose. And people often hear me talk about my story, about how influential my grandmother was to me, who always told me that I was made on purpose and for a purpose. And she would speak those words into me all the time and encourage me to identify and find out, what am I supposed to do with my life? And embrace the responsibility of that. And as I think about my journey into public health and going to college and being exposed to public health, some of my earliest research projects were looking at women in workplaces and jobs historically dominated by men, understanding their experiences, collecting stories there. I'm grateful that it was actually a mentor, and we'll talk about mentorship more later, who is the person who said to me, this can be your career, you can make an impact here, doing public health work, working with community, and this can be part of your calling. I'm grateful that I had opportunities to go to get my degrees in public health, and when I was recruited back to join the faculty at Johns Hopkins Bloomberg School of Public Health, where I completed my doctorate. After that, I went and worked at the Robert Wood Johnson Foundation. I saw opportunities to lean into my purpose in academia and really helping to advance research and practice in partnership with communities, research that would make an impact. And when the opportunity came up to apply to be dean, I felt called, especially in this very difficult moment, for global health, for public health, for women's health, also in the United States. And it was after the elections where it was really firmed in my mind that I needed to apply to be dean. And I'm grateful to be sitting here as the 12th dean of the Bloomberg School of Public Health. And I'm proud to say that my appointment was history making. So only the second woman in history and the first Black faculty in history to be to be dean of the Bloomberg School of Public Health. And you talk about joy and showing up, and that's why I show up as a leader. I believe in hope. I choose to live in a place of hope, understanding how difficult it is. And yes, there are challenges facing us every single day, but I believe in the strength and the power of the community that we are all part of. I look around this room and I see that strength, and that is how I choose to show up. And yes, it is incredibly difficult at times. It's incredibly difficult to keep people encouraged, but we stay focused on mission. We stay focused on acknowledging the fact that, yes, we've lost some funding or things have evolved and are changing. Some of our colleagues that were with us at one point have moved on to other opportunities because of loss of funding. So we are all navigating this terrain together. And I believe, again, in the power of public health, of global health, of women's health. And the work that we do is so incredibly important and impactful. And myself as a health equity scholar, I feel motivated and excited to be in this space. This is my first ICFP, and the energy here is palpable, and this is a meeting I hope to come back to time and time again. I am inspired to be here around so many women leaders, and as I look ahead and think about what we're called to do is continue to lead with hope and vision to help imagine a world that may not seem possible today, but that we know is possible. Because I wouldn't have applied to be dean if I truly didn't believe the world could be better. If I didn't have a belief that the work that we do could make a difference. Because that's what will I believe, keep us going in the most darkest times. And I'm also reminded by my wise grandmother who always said, the dark storms will end. We don't know how long they will last, but they will always end. And I'm challenging myself and my colleagues to say, well, what is going to be on the other side of when that storm ends? And how can we build forward and be prepared to help reimagine and to lean in and work with community and to advance our goals around equity and inclusion? So I'll stop there, but that's my story of how I came to this space.
Thank you so much. Thank you very much. And just listening to you, both encouraged by the history making, that your appointment has meant, and also being reflective that it's now, that's what you have broken, right? The ceiling that you've broken. So over to you, share with us as well. I mean, I know, because I've worked with you for so long, but I'd love for you to share with the rest of the people your own story of becoming, and what has it meant for you to be a woman leader in this moment in time.
No, thank you so much, Dr. T, as we lovingly call you. And it's just such a privilege and honor to be here today with everyone. Thank to the fellow panelists, of course, but to the colleagues in the room. For me, I think each one of us is a leader in so many ways. And if I reflect back on my own journey, if someone had told me some years back that I would be sitting on the stage in ICFP and speaking to all of you, I wouldn't have perhaps believed it. I come from India, from Mumbai, from a simple suburb in Mumbai, and I grew up there with dreams of doing something and making a difference in this world. Got into med school, which was a big achievement at that time for me, and I wanted to be a doctor. That was the biggest thing in my life at that point. Strong, very strong belief, just like you said, for my grandmother and my mom and a lot of strong women in my family who continuously said, yes, you can do it. And so I did it. I became a doctor. And my vision of a doctor at that time was a person who treats patients in hospitals and clinics. And that's the world I knew. But certain experiences along the way that took place, and I'll share a couple. As a young resident doctor, I used to work in the rural clinics of India. I was posted as a primary healthcare physician. And I was going about my work, treating patients as we do. But what's done was very surprising to me, how women would come to me, including couples, men and women, trying to get family planning options and products and things, but wanting to do it without telling anybody. There was so much of pressure, traditional, cultural, family, societal, that a simple decision that seemed to me as a young doctor that it should just be a patient's right to say what they want and to get that service was not that simple anymore. And it gave me an insight that there's a lot more to this than just the doctor-patient, you come to me and I'll give you treatment. It opened my eyes to the broader pieces of what drives decision-making in access to care, in quality of care, the social norms, the traditional norms, the cultural norms. It was very insightful, and I was like, I want to learn more. I want to understand why even when we are telling patients and people to do a certain thing, they don't do it. Behavior change is a fascinating topic. And so I shifted gear. I moved into public health, left clinical practice. I wanted to make a difference in the wider scheme of things, and landed up with a scholarship in the United States, actually. And so very grateful for those programs that actually supported young researchers and scientists and doctors from around the world. And I was the recipient of one of them and managed to get to a university in the States and did my master's in public health and health behavior. And then a journey started for me. I went into academia. I worked in Jamaica in the Caribbean and the University of the West Indies. I then moved back to India for some time, joined the United Nations, worked with UNICEF as their chief of their child survival portfolio, which took me across the world. I went to Papua New Guinea, I went to South Africa, Nigeria, Bangladesh. It was quite a career spanning many different settings. And across those settings, one thing stood very clear to me, that the first and foremost, the challenges are the same wherever you go. There are barriers, there are challenges. Whether I was working in South Africa, I was working in Nigeria in the remotest parts and traveled quite a bit of Nigeria, length and breadth of it. You could see that the problems that people are facing on the ground, the barriers to really getting access to quality care and treatment services was the same. And so what became very important was how were we looking at the data? How were we looking at the evidence? I got fascinated with data. And I was like, this can really make a difference. But we should connect the dots. And part of my life, because I'd been in academia as well, I knew that there was tons of work happening, research and et cetera, all of that. But there was no link to public policy, to practice, to actually changing the norm at the government level. It was also not reaching the people who invest in health, where are the resources, how governments allocate resources. And so a lot of my work started becoming on translation of some of that evidence and connecting the dots. So connections became important. I started one of the first think tanks in South Africa, again went and replicated a think tank in Nigeria, really trying to bridge the gap between academia, policymakers, decision makers, people who are practitioners, healthcare workers, and that became critical for me. I know I'm perhaps running out of time, but I want to say one more thing, and that is about young people. My work very early on in my career took me to work with young people in comprehensive sexuality education. And at that time in India, it was really tough to work and speak about anything to do with SRHR or family planning. It was just not possible. And so we sort of devised programs with life skills education and trying to bring the life skill approach. It took me and made me work with schools in India. And again, it was insightful for me in terms of equity and inclusion. And a lot of the early learnings came from there, because automatically we were looking at public schools and private schools. But when we dug a bit, when we went a bit deeper and saw what was happening, we were saying, what about the night schools? Night schools for out-of-school children who are actually coming in the evening to complete classes. What about schools for specially abled children, for disabilities, for the children who are in blind schools, deaf schools? And how do we really get to a much wider group of students? And something clicked in me, and I was like, we need to work on the last mile. It's very easy to get to people that are around you and are able to reach spaces that you want them to be in. Very hard to get to the last mile. And throughout my career, that piece has struck a chord. And so
Thank you.
A little bit of what made me where I am today. Thank you.
And I would like you to hang on to that thought about youth
Sure.
and inclusion and out-of-school youth, because
Yes.
like you're saying, people are often left behind
Yes.
in many, many programs, just even in how we think about people who should be brought in terms of upskilling, how
That's
we
right.
incorporate them, into the broader social and health systems. So please hang on to that thought, and we'd love to hear from you.
Sure.
on the
Thank you.
second round.
Thank
Yeah.
you.
Over to you, Dr. Pascal. I love
Great. Thank you, everyone. Thank you for being here, being interested enough to come and listen to this panel. I guess I would never have imagined myself as a leader. It would have been something that I would actively have run away from, because I was always really excited about doing whatever it is I do to the best of my ability. And leadership was never a thing that I necessarily aspired to. I had no big plans. I mentor people a lot, and they come to me or tell us what your career trajectory is, as if there's some sort of formula that you need to follow in order to move. But it is, I have to say, I have been incredibly lucky in life, in that I've been presented with opportunities, and I think the big lesson there is taking the opportunities and making the best of them as you can. So I started career-wise. I had a very, very supportive father who, as usual, I'm from Ghana. Most of us from low and middle income countries that have a level of privilege, you have to be a doctor or a lawyer or an architect or a professional. So that was where the big push was. But my mother was a designer, and her push, because I was a little bit creative, she also tried to push me to be a hairdresser or a seamstress. And so I did both. I did a bit of both. I ended up being in the second cohort when the degree nursing program was started at the University of Ghana, and I absolutely loved it. I just felt like I had landed where I needed to be. I loved patient care, and then after qualifying, I then did midwifery, and I absolutely loved that as well. So if you wake me up in the middle of the night and ask me, what's my profession, I will tell you I'm a midwife, even though I haven't practiced in forever.
And we love midwives.
But there was just something absolutely magical about the experience of taking women through this period, as long as the pregnancy was wanted, and the bringing life, midwifery, and so on. Now, again, having been in Ghana and being able to take advantage of opportunities, I was then sent to practice in rural communities. And because there was such a lack of capacity at the time, it was impossible to get doctors out. I ended up, as a very young midwife, being responsible and having opportunities to practice in where at the time nurses and midwives would just not have had that opportunity. And it was an incredible learning experience. I ended up then having the opportunity, with lots of curiosity, to do my PhD in a rural area in Ghana that also had a lot of endemic diseases. So I ended up doing, the PhD was on tropical diseases in pregnancy. And the overlap of malaria, schistosomiasis, onchocerciasis, lymphatic filariasis, and their impact on pregnancy. Again, because there was no other, there weren't doctors there, I had to run the antenatal clinic. I had to learn about health systems. It was when the Safe Motherhood Initiative was introduced. So it was just an opportunity, as you say, to connect the dots. You know, how can I support the woman whose husband won't allow her, because of all the gender-related issues, to access the Safe Motherhood Initiative programs? How do they decide at a family level with the gender dynamics who goes to the soothsayers or the herbalists versus? So it was just an incredible opportunity to try and bring all of these dots together and try constantly to think about how it works. We can't possibly pick on just one issue and feel that we can fix it without connecting to everything else, to the health systems, to being able to afford the services, to engaging with gender-based violence in the household and how that impacts on women's ability to make decisions and so on. So I've had, again, as I say, the privilege of doing all of that grassroots work, understanding health systems, being a researcher within that, then moving into policy. And it all kind of culminated, and it just seemed to make sense when the opportunity came to take on the position in WHO, to just bring all of those experiences together into the position that I'm in today.
Incredible, thank you. And you know, in the SRHR space, we love midwives, so love. Dr. Esther Corona, over to you. Yes, you've got some fans in the room.
Thank you very much. Thank you, ICFP. Thank you, everybody, and it's fabulous to be here and an honor to be with this fantastic panel of, you will see, extraordinary women. Well, what I want to tell you is a bit of my story, which is somehow also the story of reproductive and sexual health, family planning, sexuality education. I have been there. I have been a witness and an actor. And as such, I mean, it's very difficult to summarize 60 years of work in 5 minutes, but to me, they have been turning points in the history of sexuality as a broad field. And of course, it all came together on a first turning point on the 60s. Women's movements, youth movements, hippies, life, everything was changing, a changing world. For the first time, accessible contraception. And it all, well, it all sort of coalesced into family planning, something called family planning, and something called sex education, which was not exactly what I had envisioned, but I went from working at IPPF in London more than 50 years ago, back into Mexico, because I said, you know, I want to do something in Latin America. So I went back to Mexico and started working with the government, trying to build something into this area at a time when it was restrictive, yes, but it was difficult, yes, but it was open. Everything, you know, it was like opportunities everywhere. And I mean, there were many things that happened during those years. The build of the gender movement, gender theory, women, you know, moving forward all the time. Again, backlash, yes, because we have had opposition all the time. It's not something new. It was a different kind of opposition. And of course, then the HIV pandemic, which brought sexuality to the forefront in the terms, but unfortunately in terms of illness and of death. But we had to use that to say, look, this is something which pertains to everybody. It's not something which is beyond you. It's part of your life. And that's how slowly the movement grew. Second turning point, Cairo and Beijing. Cairo, again, a great transformation. For the first time in the hallowed grounds of United Nations, the word sexuality was mentioned. And there we transformed family planning into reproductive health. And the following year in Beijing, sexual rights and sexual health. Later on, movement kept growing, opposition all the time, and then we came through through our century, 21st century, the new definition of what we were talking about when we talked about sexual health and sexuality with WHO, because by that time we had already created the World Association for Sexual Health. At that time was a World Association for Sexology, but again, trying to be transformative. Then, comprehensive sexuality education, which is my field in reality. That's where, you know, I have been working everywhere. And going on and on and on until we get here, and I think this is the third turning point. I don't want to go very much into that because my time is lapsing, but here we are at the moment when the world is changing. New challenges, environmental crisis, political crisis, strife. Where are we? And now we're working into sexual justice. That's where we have been working and where I have evolved. And well, looking back, and I will speak about that on my second turn, about where we are and hope, because we have been there. There have been setbacks all the time, but we have prevailed.
Absolutely. Thank you. Thank you. Thanks, Julie.
Em, bueno, yo estoy muy emocionada de estar acá. Em, Creo que en últimas este encuentro nos está invitando a cada vez más reflexionar en torno a la autonomía de los cuerpos. Y acá en este encuentro estamos reuniendo diferentes agendas y diferentes luchas que en último queremos eso, que todas las personas tengan autonomía sobre sus cuerpos y sobre sus luchas. Yo estoy acá hoy como una líder gracias al trabajo de cientos de personas trans que han puesto el cuerpo, la cara y su lucha y que abrieron camino para que personas como yo hoy podamos estar hablando acá de la salud trans en Colombia. Creo que para empezar a hablar de cómo llegué a trabajar por la salud trans en Colombia, tengo que hablar de esos diferentes momentos en que las personas trans nos reuníamos y siempre el sentimiento que nos rodeaba cuando hablábamos de salud trans o de ir al médico era un sentimiento de rabia, de tristeza, de angustia, de dolor, pero siempre el continuum era este sentimiento. Y empezamos a construir diferentes modelos de cómo acompañarnos para hacerle frente a una realidad, y es que el sistema de salud era un sistema que históricamente nos había excluido y discriminado. ¿Qué podíamos hacer para que este sentimiento de dolor, de frustración cambiara? Y empezamos a construir un modelo de acompañamiento entre pares. ¿Cómo podía yo acompañar a otra persona trans a navegar un sistema que históricamente nos ha invisibilizado? Y ahí pienso que surge mi historia en la lucha de la salud trans, que empieza desde un dolor personal al encontrarnos con un montón de barreras, pero también de pensarnos que ante la exclusión nos hemos organizado para dar respuesta a las necesidades propias en salud trans. Creo que acá es muy importante también hablar de las deudas históricas que han existido en temas de derechos sexuales y reproductivos y de las personas y de las agendas que históricamente se han quedado atrás. Y yo creo que cuando hablamos de programas de planificación familiar y de los marcos de derechos sexuales y reproductivos, hemos hablado de una forma de ser mujer que muchas veces nos ha dejado por fuera. Y no solo a nosotras las mujeres trans, sino a otras identidades que se han quedado por fuera. Y creo que para hablar de mi liderazgo es muy importante que pongamos sobre la mesa reflexiones importantes, como qué está pasando sobre la violencia obstétrica en transmasculinidades, qué está pasando sobre el derecho al aborto de los hombres trans y las transmasculinidades, qué pasa sobre los derechos sexuales y reproductivos de las trabajadoras sexuales trans, qué pasa sobre los derechos sexuales y reproductivos de las mujeres trans. Y creo que hay un imaginario, y es que las necesidades en salud de las personas trans son unas necesidades lineales y que solo pareciera que necesitamos hormonas y operaciones. Pero creo que hay que salir de ese imaginario, porque salir de ese imaginario nos va a permitir saldar unas deudas en donde se han construido políticas públicas en ausencia de las personas trans. Y creo que este espacio, esta conferencia es clave, porque nos estamos encontrando con agendas y luchas muy diferentes, con personas con discapacidad que tienen mucho por aportarnos, con trabajadoras sexuales, con mujeres negras que tienen mucho que enseñarnos, con personas trans y un montón de movimientos que tenemos mucho que aprenderle, pero que también tenemos que decir, oigan, acá estamos. Y hay identidades que se han quedado atrás por la falta de representación, por la falta de políticas públicas que hablen de las necesidades propias de los cuerpos y de las vidas trans. Y creo que con esta reflexión yo cerraría diciendo que los liderazgos trans en temas de derechos sexuales y reproductivos están haciendo un trabajo increíble por posicionarse, por generar alianzas con otros movimientos, porque acá queremos llegar a tejer alianzas, a aprender del movimiento de mujeres, cuál ha sido su lucha, cuáles han sido sus victorias, cuáles han sido sus errores. Y creo que es clave que existan encuentros como estos para poder generar estrategias conjuntas que nos permitan seguir construyendo vidas felices, liderazgos sostenibles y que nos permitan hacerle frente a esta oleada de odio, de escasez de recursos, porque creo siempre que ante la exclusión nos volvemos más fuertes y nos organizamos como movimientos.
Thank you.
Oh, it's not working.
Julie, can you please close?
It's now working.
Thank you.
Thank you very much for allowing me to be here sharing this wonderful, really panel discussion with very interesting and potentiating stories of women of impact. I would like really to introduce myself with a title which I really admire, the mother of the Egyptian children. This nomenclature was given to me in 2019 because of more than 20 years in Egypt working to support the rights of the children and their mothers in proper health and proper reproductive health for the mothers. My career started 4 decades ago, being graduated from medical school with merit, with the only hope to heal children. At that time, I lost the potential to be a university staff because the first one of the team had the position, and I have to shift to another subspecialty, which I don't like. So I left the university and moved to UK, and I got all my postgraduate study there. Diploma of Child Health, 2 memberships, 2 fellowships, and I came back after 20 years to Egypt. I find there is a lot of struggle among mothers who are really devoted to their reproductive rights for choosing how many children to get, and the space between children, how much should it be. They don't know, they don't have the information, and also they don't have the rights for the informed choices. And in the same time, children, they were not taking the opportunities they should take. So I went to the Royal College. I get the membership to Egypt, trying to improve pediatric health there in Egypt. And I worked this in less than 1 year, who made the Royal College of Pediatric and Child Health give me the golden medal for caring for children alive. And same time, 2024, they give me the honorary fellowship. In pediatrics, I worked as a neonatologist, and the neonatology keep you close for the babies, small babies and their mothers. And with neonatology, you could see the struggle, the misconception, the loss of rights of the mothers. And that's why I created my national initiative, the Golden 1,000 Days for Development of the Egyptian Families. And by the Golden 1,000 Days, I tried to find a statement to change the population message from telling the mother don't get more than 2 children to telling the mother, please, space between pregnancy for 3 to 5 years to protect the right of a child in the Golden 1,000 Days to be reared alone, and also to protect your health and to support you in that. And from that, really, it was very successful to change all the statement of a population file in Egypt. But I was working parallel to the line. I was not within the ministerial authority. And I worked for 7 years where I got be nominated as Ashoka Fellow. And in 2020, I was nominated as a parliamentarian in the Egyptian parliament. And from the parliament, I could have my fight. I could create subcommittee for maternal child health and population. And from there, I got the vote of many, many parliamentarians to stand with me for the right of the children and women for spacing of pregnancy. And the authority and the government heard me, the Ministry of Health heard me, and we implemented the whole initiative in the Ministry of Health. And this made the president to nominate me as a Deputy Minister of Health for Population and Family Development, and to lead the National Population Council to change the program of family planning in Egypt from just numbers to rights, reproductive rights for the mothers and the reproductive rights for the girls to know their rights in sexuality and to fight against child marriage and to help all the Egyptian family to stabilize, to take the rights in optimal start. And really this was my file. That it's not only empowering women, no, it is empowering the Egyptian family with the mother at the center of this family and the authority all supportive the family because it is the start of the support for the nation and this is the best foundation for the children to grow in an optimized family. And this was my cause.
Thank you. Thank you very much for your interventions in that first round, really insightful and very clear that leadership is not a linear road. There are many ways of one recognizing themselves as a leader, but as Pascal said, perhaps not initially, but the circumstances made you a leader in particular ways. And I really like what the minister just said now, going from just numbers to rights, which is precisely what brings us together today. It's that this work that we are doing is often first life-saving work. And I often say to people, I'm always humbled that my work finds meaning in other people's lives, but I came into this to save my own life as a young person and to hear the different ways from the geographies that you are all located in, from the different leadership positions that you hold. That statement is still very much true, that we were first and foremost saving ourselves, and through that commitment and the time that we have committed to this, we have now built a bigger, formidable community and women around us. I was going to say it was women and mothers, and then Pascal said my dad. And I thought, yes, it is about that, yes? It is that all children everywhere should be able to grow up in families that are defined in ways that are defined, but that are conducive for them to have an equal opportunity to be able to be who they are. And we know that family planning is an important part of that story. For this second part of this conversation, I come back to you, Dean. I'll call you Dean. To just share with us, I mean, here's a statistic that I want to share in global health, that over the last 5 years, women's share of leadership in roles in global health have remained unchanged, with women still only holding 25% of senior leadership roles. So by definition, you are already exceptional by being on the stage. So how do we change that? How do we move into a future in a world that demands so much from so many of us? Understanding intergenerational mentorship and the need to build future leadership with that statistic in mind, and of course with all of your work in academia, how do we support this and change this?
This question is so important as we think about how far we've come and how far we still have to go, right? Because at some point, all of us on the stage will not be here. Where's the next generation to continue to build and keep pushing things forward? And I'll say two things. One, in academia, part of our job is to educate leaders. And that's one way that we can continue to focus on youth and bringing in young people, providing training and education and opportunity to receive training and education in schools of public health, to get the type of training. You mentioned going to the US. I mean, these opportunities are transformational. And so I think any opportunities we can to continue to help equip young people with the skills and also pour into them the hope and the belief and the value that they see in themselves that they can make a difference. So I think that's critical. On the other side, I want to just lift up the importance of mentorship and sponsorship. two terms, and I don't think we talk about the second one as often as we do the first one. And there's a wealth of literature out there that talks about how men in particular, men of privilege, have deep networks and have lots of sponsors. And women don't always have sponsors. So what do I mean by a sponsor? I'm talking about a sponsor can be a mentor. I'm talking about the people who are often at the table when we're not, who are in those positions of influence and privilege where I'm not there, but that person could lift up my name, could give me an opportunity. And I am so grateful when I think about my leadership journey that I've had many sponsors who I did not know at the time lifted up my name in a room, and that afforded a tremendous opportunity for me to lean into my leadership. And so as I think about future leadership growth for women, it is critical that we, as women and men in the room, are sponsors to people coming up, future leaders, that we're giving them opportunities, that we are pouring into them, that we are helping them develop those bold ideas and to see the world that they believe is possible. And I truly believe that that's critical as we think about the next generation of leadership. I'll stop there. Thank you.
Thank you so much.
Yeah, and thank you for raising this, and I agree completely with what you just said. I think it's so important to, there's this famous saying, pass it on, pass it forward. And I think the importance and criticality of creating those platforms, those spaces, those connections there's no doubt that that is such a critical aspect of anyone's journey. I too, I think, have been very privileged in some ways to be in the right space at the right time, or to have someone being able to support you and be able to give you that little next nudge to take something on. And it's extremely important. But I want to say something, in the work that I do today, and I work with the Gates Foundation in the policy advocacy communications team. And one of the big things that we are trying to also do is make those connections and to really see where are those local leaders, where are the platforms, where are the connections that are critical. One example that comes to my mind is Wendo Azed. I don't know if people have heard of her. She's a leader from Africa, from Kenya, who's been doing work with her own, the organization she founded, Dandelion Africa. And it was linked with something that if you read her story, you'll see a really grassroots level, trying to bring things together, address gender norms, make sure they're connecting the dots with women who need the services, starting with nothing from scratch, from a personal experience, and slowly growing and building it up, and today reaching thousands of girls and women in need. And I think it's those kind of being able to bring those stories up front and center, and being able to give that platform and space to people to talk and leaders to share the stage becomes absolutely important in where we want to go. In some aspects, I think of it like a spiral, like an interconnected spiral. You've got community leaders, you've got grassroots organizations, you've got people in the field, you've got women, you've got girls who are doing good work. How do you then make that spiral go to the next level, whether it's at the subnational, it's a province, it's a district? How do you then take that to the national level, and then how do you bring it to regional and global, and to a stage like this? Because this is where you're able to make even more of those sort of linkages. In this conference itself, we've seen young people have their voice, and I think that is an extremely important thing. Over the years, I've been in so many different spaces, and I think giving that wide sort of berth in some ways for people to express themselves becomes critical. I recall, and I was speaking about out of school young people earlier in my thing, but I recall many decades ago when I was working in India, we had rural, from the rural parts of India, young people who were trained as peer educators, and we were struggling to see how to bring their voices up front, and then stumbled upon a good idea of training them to use video and make their own films. And what became it started as a small project, became one of the biggest national projects. The stories that the young people captured from their own settings actually went on to become a national exhibit that then traveled across India, really showing the voices from the field. And so I feel the point that you're making on mentorship and sponsorship, and I couldn't agree more on the sponsorship part too, which is not necessarily always monetary. I think you kind of think it's money, but it's not. It's a lot more than that. But I think just feeling, making sure that you are approachable, you're connected, and you're able to give that space and platform becomes absolutely important.
Thank you so much. And Pascal, I want to come to you because a lot of what you do is around, standard setting and giving people that scientific, grounding for the work that we do in SRHR. From what Julie said, that we need to step out from what we know that has already been prescribed, thinking about, trans health and all of the different identities. How do you foresee, therefore, the leadership of women doing this work in equity and coming up with different frameworks that mean inclusion as we move forward?
Thank you. I think first thing, it's interesting that it is often when mentorship comes up, it's women. That it is considered a part of our role, particularly as leaders, that this is something that you will automatically pick up. Absolutely. I mean, I see it as part of nurturing. Not everybody likes that idea, and I have heard people saying just because I'm a woman in this position doesn't mean I have to support other women into that position and so on. But it is, I mean, I think it's absolutely critical. In some ways, it's part of who we are, and I think we will move it forward. I think so I actually think and treat the ideas around mentorship almost as an academic exercise. We have lots of mentorship programs. And a lot of leadership programs and so on. I think sometimes some of them are not very well thought out, so they run the risk of perpetuating the kind of the power relationship that requires this to happen. So we do need to think about when we're with mentorship programs, are we perpetuating a particular stereotype, because that is not inclusive. You have to be in a particular space to be able to get into the mentorship programs. So what about all of those who are not? So I do think that we have to, that there is an intentionality about it that we really do need to think through as given the positions that we're in. A critical part of it for me, because of the area that we work in, is making sure that it is grounded in the values that we think. I don't expect walking into a place that my title entitles me to anything. I believe I need to earn respect. I need people to actually see that I act with integrity, and that to me makes a lot more, that is much more valuable than just the title. If I can give a quick example. So I lived and worked in Malaysia for a long time. The issues of, I mean, gender, given what we're talking about, gender and women and all of that are clearly an issue. Race was definitely an issue. Religion was an issue. So we've spoken about equity and inclusivity and intersectionality and so on. And it was, I'd started and I would walk into a ministry with a range of male colleagues, white male colleagues, and it was like I wasn't in the room. It was always assumed that I was the secretary or I was the support person and so on. But just by working, some of it is just thinking, okay, what is it what I would like to achieve? And it doesn't necessarily matter who is the front person for it. If it needs providing briefing notes to the white male in front to get the change done, that's fine. And by 3-5 years in Malaysia, the people in the ministry would call me directly. Now that to me is leadership that I have earned. And it means so much, it meant so much more to me, and these are networks that I now have, than somebody who would just pick up a card and say, okay, this is the professor and therefore I want that person. And I think as we think about how we mentor and how we talk about these sorts of issues for the younger generation, we need to make sure that the values that lead to leadership are as valued as being in the position. The two questions I always ask people when they come, you know, I want to mentor, can I come and talk to you, is what is it you want to do, or what is it you want to be? And it is in terms of trying to move leadership forward, the responses to those questions give you a very different sense of how to support the person. I'm not going to judge if you just want to be my aim is to be a professor. It's like, okay, this is how I can help you, versus this is what I would like to change in life, and so on. So I think it's incredibly important that we take on these roles as mentors, but we have to be intentional about what it is we are doing to support people within that space.
Thank you very much, Pascal. Thank you. And you were talking about the third inflection point in your remarks, and you spoke about environmental justice, about social justice, and how you've come even to new definitions of sexuality, and I would even say pleasure, right? Because this is what it's about ultimately, how to have the best kinds of human experiences we can, and understanding, of course, with the different, you know, issues on consent, CSE, safer sex, and all of those. There are definite important conversations to be had. So in your next sort of envisioning of what leadership looks like for this phase we are in the next, how do you see your role then in having that intergenerational support of new women leaders, of new young people in this space?
Thank you. There are so many reflections to come to mind when you listen to all the stories that are being told now, because each one is an individual story, and it also talks about the context that we have been living in. Many similarities, but many differences. But some of them are common to all women. And particularly when you think about how leadership has evolved, for instance, in family planning, the first people who spoke about family planning were women. Margaret Sanger, and then funding IPPF. There were women everywhere. Something turned the tide. And you know what it was? Money. When money came into play, when funding was available, when it became a different kind of issue, and women were sort of maybe not completely pushed out, but in some way they became invisible. It has been a long struggle to really recover that leadership, and it's wonderful seeing that it has been recovered in many places. But it has meant gender clauses and fighting, and again, what we all know, showing that we can do things, and sometimes in that particular area, in that particular field, that we can do it better. That's the bottom line. But slowly, leadership has, again, women have recovered, not because only in this field, but because of all the struggle women have been doing everywhere. And that comes from grassroots as well. I mean, it has always been there. The midwives, I mean, who were the people who were really dealing with this kind of problems? Who were the people that were being asked to determine sex in a child? Women. And I mean, maybe in a very different, and as I say, very unusual and sometimes difficult context. So it has been really a great struggle, but it's great to see again that at least in this field, we are seeing a change of balance, and something that was mentioned by one of you is the fact that we are creating leadership. I was very touched by the fact that on Sunday we had here a pre-conference session on sexuality education. And at the end, I was asked to do the closing remarks, but the synthesis, the really work of gathering what had been said was done by a young woman. And here we were sitting together, and as I say, maybe one of the youngest persons in the group, while at the same time, there I was, maybe one of the oldest people in the room and in the whole conference. I mean, I'm very much aware that maybe, I'm one of the oldest, and no regrets about that. So that gave me a great, hope in the future, in the sense of seeing this connection between these two women. One who ages ago had struggled into getting into the field, talking about sexuality, making it something not only acceptable, and bringing in, of course, science as well, speaking from the heart and the brain, but also including things like pleasure, which was absolutely unheard of. And again here today, I think this link, this young woman was talking about, she was claiming her right for being herself, for bodily autonomy, for pleasure, that is, for being able to live in a full life with well-being, even in these difficult times. So that link, women, leadership being created within women themselves, to me, it's something that sparks hope.
Thank you. And for you, Julie, what does success look like? The issues that you speak about are urgent. And what does it mean to upscale, but having women lead in these policy changes that you've spoken and that are so urgently needed?
Hola. Cuando nos enviaron las preguntas del panel, yo pensaba mucho que cuando pensamos en innovación en salud y derechos sexuales y reproductivos, casi siempre pensamos o nos imaginamos nuevas tecnologías o nuevas políticas. Pero en el caso de la Liga de la Salud Trans, que es la organización donde yo trabajo y que trabaja por la materialización del derecho a la salud de las personas trans y no binarias en Colombia, la innovación más poderosa ha sido poner el cuidado y la vida trans en el centro de la respuesta. Y poner el cuidado en el centro de la respuesta lo hemos venido desarrollando en un modelo de acompañamiento entre pares, que este modelo de acompañamiento entre pares formamos a otras personas trans para navegar el sistema de salud, para no navegar solas el sistema de salud, sino navegar acompañados. Y este modelo nos dimos cuenta que no solo salva vidas, sino que transforma también relaciones de poder. Porque demuestra que el conocimiento también se produce desde la experiencia vivida, desde los saberes encarnados, desde los cuerpos que históricamente han sido silenciados. Y acá creo que es clave pensarnos también, cuando pensamos en innovación, pienso mucho que desde la Liga de la Salud Trans nos pensamos en algo clave, y es cómo empezamos a generar datos, porque a partir de los datos se crean realidades y se crean políticas públicas. Y las políticas públicas históricamente no han contado con la participación real de comunidades históricamente marginalizadas como son las personas trans. Y creo que acá es muy interesante también ver este cambio generacional y ver estos nuevos liderazgos que están pidiendo a gritos que su voz sea tenida en cuenta, que en temas donde antes no podíamos llegar a espacios a posicionar el tema de aborto en transmasculinidades, hoy en día nos plantean las nuevas generaciones que estas discusiones se hagan a partir de alianzas. Y pienso mucho en una emoción y un sentimiento, y es la rabia, porque nos han enseñado que la rabia es mala sentirla, pero la rabia en el movimiento trans, cuando hablamos de cuidado, también ha sido un movilizador para crear, para organizarse. La rabia es un móvil que le permite a las personas trans construir sistemas de salud diferentes, acompañar a su par para construir nuevos futuros.
Thanks, Julie. And over to you, Minister, for your sort of second round of intervention about innovation, the ways in which Egypt has been able to be part of the global leaders in maternal health and looking at the different outcomes. I mean, we know globally the SDGs, we are all lagging behind, but there are pockets of excellence that we can all speak to when it comes to these very important issues of maternal health and access to safer options, but also modern options of contraception and family planning.
Thank you very much for the question. Actually, yes, in Egypt, we are moving really quickly in the field of human rights in the reproductive health, giving the woman all the option of the mix of the family planning methods and all the information and the counseling regarding this family planning methods, and give her the full right to choose what is suitable for her. And this we could reach to each woman in the country through a transformation of the primary health care, where we have 5,000 primary health care distributed throughout 27 governorate. And we created a network of family counselors who are really high-class pharmacists, dentists, physiotherapists, and they had the task sharing to get trained and to start working with the mothers, to give every woman from 15 to 49 years come to the primary health care. She should go to the room for family counseling, where we allowed her counseling with privacy, so she can really have her chance to have all the information she needs to discuss everything related to her family issues. And at the same time, we had a way of going throughout the primary health care, making the family counseling room the first room to apply no lost opportunity. No woman come to the primary health care for any reason should go first to the room for family counseling and take her a chance for all the information about her reproductive health, and if she need any facility or any commodity, she can go and they get help to insert it. Even, we faced in Egypt that 30% of our mother who put the contraception, they remove it in the first year after insertion. And this was really a challenge that we need to know why this happened, and to find a lot of misconception about using the contraception, and we could really work on that to give them the proper information of the side effects of which comes with contraception, because there was a lot of rumors saying that the hormonal contraception can cause cancer, the long-acting contraception can cause infertility, and this all needed us to work hard to get rid of it. In the same time, we had 20% of our mother having unwanted or unintended pregnancy. And this again was another challenge that we needed to know why this is happening. And we could help to come down from 20 in the last survey to 7.5 by proper counseling and proper use of the long-acting contraception instead of the short-acting, because 80% of the mother denoted that forgetting the pill or forgetting the time for the injection was the cause behind the unintended pregnancy. But what I want also to add here is very important, that for the question you was asking, we are really potentiating mother's health, and we had reduced the maternal mortality rate to 17 per 100,000. This is because of working with the mother from early on, from child age, and trying to empower the girls with all facility of education, going to work and valuing the work. We find in one of the surveys that 70% of the females or the women, they don't want to work. They don't work and they don't want to work. And despite that, 40% of students in the university are females. So we get a lot of them who are really educated, but they don't want to work. For a cause of another, you need to potentiate the value of work rather than working for money or working to improve your lifestyle. So this also made us to work closely in secondary school children and in the university, youth leading youth, to create the champions among the youth, and this helped us a lot to reach to vast majority of our women in the age of youth. And the premarital counseling also helped us a lot to reach to every single family being started in Egypt. Now we can say that we came down with the total fertility rate to 2.4 and from 3.5. And this was a success story, but what we are looking now for is to potentiate the woman's life and development rather than only to reduce the number of children. And this is the challenge for the coming period. Actually, it is globally. We need to work on development rather than just number of children. Thank you.
Thank you very much. And in the interest of time, I'm going to ask all of us to be innovative in the moment. So instead of the 2 minutes that you had prepared, we have now cut it to a word of inspiration. So work with me. And let's show that women of impact can be innovative on the spot. I'm going to just ask all of you just to prepare for me as we think, as we are hopeful, as we look to the future. What is that one word you would like us to leave this room having captured from your experience, from what you envision for the future, so that we can hold on to that one word to inspire, to motivate, and to continue having this community of ICFP connected. Some of you said it's your first ICFP. I hope it's the first of many to come. This space is electrifying and continues to be a safer space for young people to really be the true leaders that they are in the world. So I will start over with you, Dr. Keisha Pollock Porter, and already say my thanks to you for joining us. What is your one word?
My one word is liberation.
Thank you. And over to you, Dr. Sanja.
I would say my one word is impatience.
Yes. Dr. Pascal?
My one word is integrity.
Dr. Esther?
Solidarity and passion.
Thank you. Julie?
Hola. Una palabra, esperanza.
My word is networking and starting from the beginning.
Beautiful. And I need say anything else. Thank you very much to our incredible panelists of incredible women in leaders that I have looked up to, and I know that many of us in this room continue to do so. So thank you very much for joining us for this panel of women of impact. Thank you very much.
Thank you.